And we put them through by clinical groups, and each group we had like 8 students at a time come through and played the call light game. Oops, sorry, the other side. So the call light game. So the way this works is we have 2 games with Life Care Sim, and one is Ponder, the Socratic Way, and the other one is the Call Light game. And so you're going to combine these two in the simulation lab to create a hospital environment. So the way you prepare is the night before, you're going to get your mannequins ready for your students. Now, obviously, I don't have room for a mannequin today, so I brought my little friend right here. Let me get him over here without falling him over here. So this is my mannequin, my patient. So if you'll notice, I have set him up however I want to. We've got an IV going. It's actually lactated ringers. I don't know if you can see that hanging up here, but he's got an IV going. I have placed a cast on his leg, and don't make fun of this guy. He has the same year that I was born, 19, not going to say, stamped on his bum. I've had him since a kid. And then he also has an abdominal dressing on. I don't know if you can see his abdominal dressing, but he does have an abdominal dressing and it has some blood on it. So I have my mannequin, and you prepare your mannequins however you want to, because that's actually going to add to the experience for students, because they're going to have to go in and they're going to have to assess their patients. So you'll have your mannequins set up however you want to. I love to throw things at them like an amputation, because they'll lift up the cover and see that. You need a bell. You can also use a buzzer you download on your phone, and then you're going to need like a hat or some kind of a container to put all of your students' names into a hat, so to speak. So the way you play the game is you're going to take the part of the original Ponder game to create your patient. So you're going to draw a demographic card like this, and this one is a 75-year-old male, formerly a factory odd job worker. He's recently widowed and showing signs of early dementia, and he lives with his sister. So that's the demographics that when students come in, you assign them a mannequin, and then they're going to come up to the Ponder game. They're going to draw a demographic card that's going to give them information on their patient, and then they're going to roll a bunch of dice. They're going to also help create their patient that they're going to apply to their mannequin. So I'm going to shake up my dice, and I'm going to roll them out. And I have the patient also has diabetes. Okay. He also is on Zosyn. Okay, Zosyn 4.5 grams IV, Q 4 hours. He is 280 pounds, 5 feet 9 inches tall. He has a blood pressure of 134/74, a pulse of 99, respirations of 20, temp of 100.4. He has nausea and vomiting for 3 days. He has blood cultures that are positive for gram-negative rods. And he has a hematocrit of 46%, hemoglobin of 14, platelets 605, INR of 1.1. So the students apply all of this information to their mannequin that you have assigned them to. When they also are assigned to their mannequin, they're going to have an electronic health record. Now, Life Care Sim provides a very simple, basic electronic health record, but ChartFlow has a beautiful electronic health record that they can also use, and you get a free, I believe it's a 6-month trial with it that you can open up and use when you have Ponder and the Call Light game with you. So once they've got their patient, they have their electronic health record, they're going to read their record. They're going to look at orders. They're going to look at an MAR. They're going to look at a place where they can document at the very minimum. So as they're caring for their patient, though, you're over there and you have your handy bell. You're going to ring your bell. You're going to draw a name out of a hat. And, Darla, your patient is calling out. So Darla's patient is calling out. You're going to draw a call light card. And these call light cards can be anything from, this one is, your patient called out and needs to use the bedpan. Take appropriate action. I have a bedpan. So they're going to use their bedpan. So, but it can be anything from I need a bedpan to I can't breathe and everything in between. So, another example is the medical assistant reports that the patient's blood pressure is 180 over 90. Take appropriate action. So, what does the student do? Does the student go and take the blood pressures themselves just to make sure? Do they jump in to take giving medication? Does that patient have medication ordered for blood pressure? Are they going to have to call the provider? So all of these things are kind of incorporated into that, and it's random, so you don't really know what they're going to get. Now, I can also tell you that you can stack the cards if you really want to. And sometimes I do if there are specific points I want to get across. So I may stack the cards. They may have to been placed on, this one is your patient's been placed on isolation of instructor's choice. Take appropriate action. What might have led to this? So now you have a patient on isolation, and that student has to take care of that patient using all isolation precautions. Another example, they may have to role play. So the patient's family member is called out and said, something's wrong, come quickly. You arrive in the room and notice that the patient's mouth is drooping and the patient's speech is slurred. Take appropriate actions. Describe actions taken and give rationale for taking them. Include this in your paperwork at the end of the day to be prepared to discuss at the end of simulation. When I did this with the groups in clinical, when we put them through this as an exercise, we actually had them write care plans or concept maps rather to describe their patient and what went on and how they took care of their patient. Now, there are other cards that are going to actually pop up, and this one says the nurse has to transport the patient to dialysis. What things, if any, need to be considered for this patient regarding medications before and after dialysis? Transport the patient to the area of instructor's choice and back after the event. So when they come back, they're going to draw a destination card. Now, I love this card because I actually had the patients load their mannequins up into a wheelchair, and they had to go. We had a 3-story building, so they had to go all over the building. And when they got to the other spot where they were instructed to go, I had an envelope waiting for them. So the envelope now is a destination card. And so they draw a destination card, and this destination card states that as the nurse was transporting the patient from the destination, the patient began having nausea and vomiting. What action or actions does the nurse take while in transit and upon returning to the room? Take appropriate actions and give rationale for taking them. Include this in your documentation and or paperwork at the end of the day to be prepared to discuss at the end of simulation. So they actually in their charts have a place for documentation of nurses' notes, so they can actually document the nursing notes as they go. So this is an excellent way to bring students into kind of the real world of nursing. This one has, let's see. Provider phoned and ordered an IV of 1,000 D5W to be initiated to infuse at 125 cc's an hour. Take appropriate action. Calculate and regulate the drip rate because you were in a rural area and you do not have an IV pump. Well, in my particular patient, his IV is D5LR. So what are they going to do? How do they change that out? They're going to have to do those technical skills that we have to do every day on a single basis. Here's one that the provider has ordered an NG to be placed at intermittent suction on your patient because the patient has developed a partial bowel obstruction. Take appropriate action. What things can cause bowel obstruction? Is your primary patient at risk for small bowel obstruction? And so these are the kind of things that's helpful if you have an additional instructor or two. So as the students go through, you're sitting there and you're ringing the bell periodically. You're drawing a name out of a hat, and then you're drawing a call light card. So it's kind of like being on the real floor. And as we were putting students through it, they at the end and they got done, they're like, oh my gosh, wow. This really opened up my eyes and really made me realize more of what it's going to be like. So they really had to look at everything going on, and they had to prioritize what their actions were. They had to make decisions. There are cards in here that they may have to get a new admission, and if they get a new admission, they roll out a new patient and have to get a history and physical. So they would role play, obviously, with an instructor to take a history and perform a physical, and they could perform a physical on the same mannequin that they had. Now, when I presented this at the IMSH 2014 Serious Games and Virtual Environment Showcase, the game won runner-up Best in Show in the category for instructors. And I had to make a video to present at the conference so it would show what my students were doing. And so I invited some seniors to come and do the video, and they were excited to come and help me out. And it was late in the evening when we shot the video. And so we had juniors who were leaving the lab after they had completed their lab for the day. And so I said, hey, do y'all want to come in and play the call light game for a little bit? And they're like, oh no, we wouldn't know what to do. We would just be so, no, and it's like, no, come on. And what I'll do is I'll pair you up with a senior, and then, the senior can be like your preceptor. Y'all, it was amazing, because to see how they paired together and worked so incredibly well, and the seniors were teaching and the juniors were learning, and it was beautiful to watch. And at the end, after an hour of filming, so okay guys, we're all done, let's go get pizza. And do y'all know that they said, hey, can we play a little longer? And that to me spoke volumes about how much this game really kind of transformed things for them, and it provided a safe learning environment. There was no stress, there was no pressure, like oftentimes students will do if they're in the middle of a simulation. And sometimes simulations, I don't know. I did a questionnaire. I did a study that actually got published. It was spring of 2015 in Nurse Educator. It was an innovative brief. And I looked at the students that played the call light game and played Ponder, and I had a Likert scale questionnaire. And on that questionnaire, I asked questions like, did this stimulate your critical thinking? Did you like it better than, regular simulations? Did you like it better than case studies at the end of the day? And by far, and so the scale went from 1 to 5, 5 being the best, and overall scores were 4.5, and it scored 4.5 or 5, and it stimulated my critical thinking. Also in it was fun, but I also had an area where they could write information freehand and they could do subjective data. And so the students by far loved the fact that it was unpredictable, that it felt like they were on a real floor, that it was non-threatening, that they could bounce ideas off of each other, which was huge. And then the thing that they didn't like, though, most of all, was they didn't win. So when students, as they're caring for their patients, you can also add the additional awards cards. So when they get questions right, you can give them a status improved card, because their patient got better. When they take care of an urgent situation, they can get a real nurse card. Uh-oh, wrong one. They can get they can get a real nurse card for correct answers and taking care of urgent situations in a manner that is certainly appropriate. Or you can give suffered setbacks, if they do something. That one probably not so much, because you don't want to make them feel bad, or anyway. But anyway, the others can also give them a boost of confidence if you give the status improved and real nurse cards. So that is kind of it in a nutshell. I know this is kind of a short, brief session, but we did it that way so we could get some folks maybe on your lunch break or whatever, and sometimes shorter is better. I'd like to open it up for questions. What kind of questions do you all have? Comments? Okay, I have one in the chat. Let me open that up. Yes, so as a tabletop game, absolutely. So Ponder, the original game, the Socratic Way, is played as a tabletop game, and so to do that, that is a little bit different. So you just don't have the mannequins in there. That particular game also involves questions. And there is, if you go to the website for Life Care Sim, you can see a demonstration on Ponder the Socratic Way. But yes. And then the next question, and thank you for that question. The next question is, how long does the activity last? That depends on how long you want it to last. So if you want to do it for an hour, like I think I shot the video in an hour. I think I did. You can do a 2 hour lab, a 4 hour lab. It just depends on how long you want to do it, really. Let's see. When you use ChartFlow, do you just open a new patient activity? Now, that is something that ChartFlow will have to answer, and they definitely can walk you through that. We have specific charts that are going to kind of be geared towards the call light game.
I
The
can tell
chart
you
that I
real
have.
quick.
Thank you.
Yeah. This is Nikki from ChartFlow. So, yes, you would set it up so students enter their own patient data. So they would open a new patient. We would have all the same flow sheets that you would normally see in ChartFlow. So everything's going to be in there. But if you were using a standard patient scenario that you are putting the call light game on top of, so like if you had a diabetic patient that you're already using the standard scenario for, you can pre-build that patient or use one of our pre-built patients. And if you do have ChartFlow, but you need some help doing that, just send us a message afterwards and we can walk you through it when it's just us.
Excellent. Thank you. Let's see. How do I purchase? Go to www.lifecaresim.com. And there's the Life Care Sim. It's all one word, all lowercase.com. What's the ideal group size for the call late game? Like I say, we did groups. So we did our clinical groups, each one through there at a time. So 8 or 9 for the call light game. It really kind of depends on how many extra instructors you have also, because you can be hitting the call light and then you want the student that's called on, that their patient's call light has gone off with, to be able to work through the question that you have drawn for them and to guide them and give them maybe feedback. So it really depends on how many instructors you have, but and how big your sim lab is as well. So how many mannequins do you have in there? Let's see. We do have ChartFlow and still trying to figure things out. Thank you. Appreciate that. And I know Nikki will be happy to answer questions that you guys have. Let's see. I'm trying to access the site from my computer and phone, but it's taking time to load or time's out. Ooh, I'm so sorry about that. Let me check and see what I have on my end here. Let's see.
If you're specifically talking about ChartFlow when you're logging in, I can respond to that. However, if you're talking about the webinar itself, that would be through the Zoom software, so I wouldn't be able to help with that. But you can message Nikki, me directly if you have an issue with ChartFlow that you're trying to work out.
Okay, so yeah, same issue with Life Flow Sim. So Life Care Sim. So I actually just pulled it up. So www.lifecaresim.com. So I'm not sure, do you have a block on your phone or something like that? It's a secure site, so should not have problems with it. Yes. Okay, I will check on my end after we get off, but like I say, I was able to pull it up on my phone, and it looks like that. No problem. Want to chat to one? Yes, yes. Thank you, Carolyn. Thank you. Appreciate that. It really does allow prioritization because they have to figure out how they're going to take care of of things that pop up, just like they do on the floor every single day. And I kind of created this because as a nurse, especially when I first started out, it was really challenging. And I've written every single one of these scenarios because, I either experienced it or somebody else experienced it. And I really wish I'd had that information before I'd walked in there. So yes, do check your firewall because that could possibly be causing it. So awesome.
And just so everybody knows, after this, we do send a follow-up email. So anyone who registered for the webinar will get a follow-up email, and we'll put all the links to both the recording and any of the products mentioned in this webinar in that email, so you have them if you need them.
Awesome. All right. Well, I appreciate everybody's time today. Thank you so much. I do know how valuable it is. I taught at the University of Tennessee Health Science Center for 10 years, so I do get it and appreciate it very much. And if y'all have any questions, please reach out to us.
Thanks, everybody. I'll go ahead and end
Oh,
it
hey,
now.
Christy. Cool. Thanks. Ah, mental health.